Welcome, everyone, to the OphthoKnight quiz show, the ultimate interactive challenge for ophthalmologists from around the world. Test your knowledge, compete, and win. Every week, we go live with a fast-paced, high-energy ophthalmology quiz. You'll face real clinical scenarios, rapid spot diagnoses, and investigative decision-making, putting your practical ophthalmology skills to the ultimate test. Compete against ophthalmologists worldwide in a quiz that's fast, challenging, and fully interactive. Here's how it works. Answer in the comments using only the number 1, 2, 3, or 4. Only one answer per question counts. Multiple submissions will be disqualified. Answer quickly. Don't wait for the full question to be read. The winner is the one with the most correct and fastest answers. Over the past weeks, hundreds of outstanding ophthalmologists have joined our quiz. Here are some of our brilliant winners. Look at those scores. Incredible work. And heartfelt congratulations to our champions. Maybe next time, it'll be you. Winners also receive a symbolic gift, but the real reward is sharpening your ophthalmology skills and competing with the very best. Are you ready to take the challenge? Subscribe to OphthoKnight, join the live quiz, and maybe your name will be the next on our winner's board. We go live every Friday at 11:30 p.m. Cairo time. To join, simply subscribe, turn on notifications, and be ready when the quiz begins. All you need is your knowledge and your speed. Join us live and see if you have what it takes to become the next OphthoKnight champion.
Welcome to our live trivia show. Get ready to test your knowledge in the fascinating world of ophthalmology. Whether you're a seasoned eye care professional or just love learning about the science of sight, you're in for an exciting challenge. Tonight, we'll dive into everything from corneal signs and imaging techniques to neuro-ophthalmology, glaucoma, and pediatric eye disorders. Expect 25 carefully crafted questions, each with 4 answer choices. Only one is correct. The faster you answer, the more points you earn. To play, simply comment the number of the correct option or type out the full answer. Sharpen your vision, it's time to begin. Remember, 25 questions, 4 options, 1 right answer. Speed counts. Comment the number or full answer. Question 1 of 25. Let's kick things off with a corneal conundrum. What condition has epithelial bands of gray, feathery lesions and whorled patterns? 1. Gelatinous drop-like corneal dystrophy. 2. Epithelial basement membrane dystrophy. 3. Meesmann corneal dystrophy. 4. Lisch epithelial corneal dystrophy. Comment the number or type your answer. Don't blink, time's ticking. Lisch dystrophy often shows whorled patterns linked to X chromosome inheritance. Fascinating, right? Correct answer, Lisch epithelial corneal dystrophy. 33 players got it right, impressive. Shout out, Mr. Native, Abdullah, Dr. Shima, Salma. Question 2. Time to test your techie knowledge. Which device best measures posterior corneal curvature? 1. Scanning slit topographer. 2. Keratometer. 3. High-frequency ultrasonography. 4. Scheme flood camera. Lock in your answers now. Precision matters in every millimeter. Posterior corneal curvature affects accurate IOL power, especially after refractive surgery. Correct answer, scheme flood camera, great job. 46 out of 49 answered correctly. Kudos Dr. Basant, Abrar, Reem, Asma. Question 3. Let's talk nerves and zoster. Which ophthalmic branch is usually affected? 1. Trochlear nerve. 2. Nasociliary nerve. 3. Lacrimal nerve. 4. Frontal nerve. Think fast. Herpes zoster doesn't wait around. Herpes zoster ophthalmicus can signal serious eye complications if untreated. Correct answer, frontal nerve, well done. Only 3 of 49 answered correctly. Shout out to Mohammed, Ayub, Doa. Question 4, Lash Lovers, this one's for you. How long for full eyelash regrowth? 1. 4 months. 2. 3 weeks. 3. 2 months. 4. 1 month. Choose wisely, beauty and biology go hand in hand. Eyelashes protect eyes from dust, debris, and small airborne particles. Correct answer, 2 months. Great job. 16 of 51 players got it. Shout out, Mizo, Saeed, Dr. Hassan. Question 5, time to focus, retina detectives. Which FA pattern peaks in brightness earliest? 1. Window defect. 2. Staining. 3. Pooling. 4. Leakage. Lock in your answers, fluorescence never lies. Fluorescein angiography helps visualize retinal blood flow using fluorescent dye. Correct answer, window defect. Well done. 42 of 52 players nailed it. Shout out, Reem, Omar, Mohammed, Asma, Safe. Question 6, surgical smarts. Let's test them. Which recommendation doesn't belong here? 1. High fragmentation power. 2. Core vitrectomy first. 3. Observe small fragments. 4. Delay with corneal edema. Think carefully, precision matters in the OR. Vitreous traction can worsen if lens fragments aren't removed carefully. Correct answer, high fragmentation power, careful. 20 of 48 players got it. Shout out, Asma, Waima, Mohammed. Question 7, time to flex that fundus knowledge. Which retinal signs scream ischemia? 1. Venous beating, new vessels. 2. Microaneurysms, IRMA. 3. Hard exudates, new vessels. 4. Blot hemorrhages, IRMA. Eyes on the prize, lock in answers now. IRMA stands for intraretinal microvascular abnormalities, seen in severe retinal ischemia. Correct answer, venous beating, new vessels. 35 of 52 players answered correctly. Shout out, Obaida, Dodi, Sarah, Mr. Native. Question 8. Let's test your AMD pattern recognition. Which RPE change doesn't belong? 1. Non-geographic atrophy. 2. Geographic atrophy. 3. Focal hyperpigmentation. 4. Diffuse hyperpigmentation. Eyes sharp, choose wisely and lock it in. Geographic atrophy is a late-stage form of dry AMD progression. Correct answer, diffuse hyperpigmentation. Well done. 36 of 52 players got it. Heba, Mizo, safe, asthma, great job. Question 9, Vitrectomy Visualization Showdown. Let's go. Which statement doesn't quite belong here? 1. Wider view angle. 2. Enhanced stereopsis. 3. Easier view through gas bubble. 4. Easier view through cataract. Think carefully, precision matters in surgery and trivia. Vitrectomy helps treat retinal disorders by removing the eye's vitreous gel. Correct answer, enhanced stereopsis. Tricky one. Only 9 of 48 answered correctly. Shout out, Mr. Native, Mariam, Ayub, Mohammed. Question 10 coming in, time to flex those ophthalmology muscles. How does scleral buckle surgery affect IOP readings with a Goldman tonometer? 1. Inaccurately low. 2. Inaccurately high. 3. Completely not useful. 4. Approximately the same. Think carefully, tiny changes can mean big diagnostic differences. Goldman tonometry measures eye pressure by flattening the cornea. Precision is essential. Correct answer, inaccurately low. Tough question. Only 5 of 50 got it. Kudos, Mr. Native, Allah, Ayub, Mohammed. Question 11 now, let's talk anterior chamber depth and corneal thickness. By Van Herrick method, when is the chamber considered narrow? 1. 3 of 4. 2. 1 out of 8. 3. 1/4. 4. 1/2. Precision matters, tiny fractions can mean big clinical decisions. Choose wisely. Van Herrick method uses slit lamp to assess angle depth, quick and non-invasive. Correct answer, 1/4 corneal thickness. Nice! 32 of 45 players nailed it. Shout out, Reem, Dr. Basant, Asma, Shima. Question 12. Focus on pediatric glaucoma and clinical clues from appearance. Which condition shares this mechanism? 1. Uveitic glaucoma. 2. Pigmentary glaucoma. 3. Congenital glaucoma. 4. Carotid cavernous fistula. Trust your instincts, diagnosis often starts with what we see. Carotid cavernous fistulas can cause eye redness, ptosis, and elevated pressure. Correct answer, carotid cavernous fistula. Impressive. 24 of 50 players answered correctly. Shout out, Dr. Basant, Mohammed, Saif, Reem. Question 13, IOP's high, photos revealing. What's the glaucoma mechanism here? 1. Pupillary block. 2. Ciliary body rotation. 3. Anterior segment neovascularization. 4. Angle recession. Think pathology, pressure, and patterns. Submit your best guess now. Neovascular glaucoma often follows retinal ischemia, like from diabetic retinopathy or vein occlusion. Correct answer, anterior segment neovascularization. Well done. 12 of 48 players got it. Congrats Dr. Mohammed, Allah, Basant, Ahmad. Question 14 coming up. Population data meets glaucoma risk. Ready? Who's most at risk here? 1. Male Chinese. 2. Male black. 3. Female Chinese. 4. Female black. Think demographics and anatomy, locking your answers now. Angle closure glaucoma is more common in hyperopic eyes with shallow anterior chambers. Correct answer, female Chinese. Well done. 18 of 51 players got it. Congrats, Ahmed, Waima, Mohammed. Question 15. Let's test your diagnostic instincts. IOP's high, cuppings deep. 1. Posterior polymorphous dystrophy. 2. Essential iris atrophy. 3. Cogan-Reese syndrome. 4. Chandler syndrome. Think genetics and corneal clues, locking your answers now. Posterior polymorphous dystrophy can mimic glaucoma due to endothelial cell abnormalities. Correct answer, posterior polymorphous dystrophy. Nice! 19 of 48 players answered correctly. Well done Heba, Saif, Sarah, Mohammed. Question 16. Time to test your A-skin knowledge. Which one doesn't affect axial length? 1. Posterior staphylomas. 2. Silicone oil in vitreous. 3. Flat corneas. 4. Air in vitreous cavity. Think physics, think media. Submit your answers now. A-scan measures eye length using ultrasound. Accuracy depends on media clarity. Correct answer, flat corneas. Well done. 27 of 52 players got it. Shout out to Allah, Eyes World, Asma, Mohammed. Question 17. Let's focus on pediatric eye conditions. What's the most common congenital cataract? 1. Sutural. 2. Polar. 3. Nuclear. 4. Lamellar. Think development, think genetics. Lock in your answers now. Lamellar cataracts often appear symmetrically in both eyes during infancy. Correct answer, lamellar. Nicely done, everyone. 27 of 48 players answered correctly. Shout out, Ahmed, Eyes World, Ayub. Question 18. Post-op day 1, vision's not perfect. What's the likely cause here? 1. Cystoid macular edema. 2. Retained viscoelastic. 3. Endothelial dysfunction. 4. Acute post-op uveitis. Think clinically, what fits best? Lock in now. Viscoelastic left in the eye can temporarily blur postoperative vision. Correct answer, retained viscoelastic. Well done. 12 of 49 players got it. Shout out, Muhammad, Saeed, Shima, Amar. Question 19. Timing is everything in post-op care. When does CME peak after cataract? 1. 6 to 10 weeks. 2. 2 to 4 weeks. 3. 1 to 2 weeks. 4. 10 to 14 weeks. Clock's ticking. Trust your clinical instincts. Submit now. Cystoid macular edema often affects central vision after cataract surgery. Correct answer, 6 to 10 weeks. Great job! 35 of 50 players answered correctly. Bravo, Eyes World, Safe, Mizo, Allah. Question 20. Let's test your neuro-ophthalmology skills. Sudden bilateral HM vision post-surgery. Diagnosis? 1. Posterior ischemic optic neuropathy. 2. Non-arteritic anterior ischemic optic neuropathy. 3. Dorsal midbrain syndrome. 4. Arteritic anterior ischemic optic neuropathy. Think fast. Neuro clues are in the details. Light-near dissociation often suggests midbrain or optic nerve pathway involvement. Stay sharp. Correct answer, posterior ischemic optic neuropathy. 26 of 46 players got it. Well done Ahmed, Ayub, Nazef, Anas. Question 21. Neurology meets perception in a fascinating way. Patient sees motion despite NLP vision. What's that called? 1. Riddick phenomenon. 2. Pulfrich phenomenon. 3. Charles Bonnet syndrome. 4. Anton syndrome. Trust your neurovisual instincts. Answers coming in fast. Riddick phenomenon involves motion perception despite cortical blindness. Pretty fascinating brain trick. Correct answer, Riddick phenomenon. Well done. 15 of 50 players answered correctly. Shout out, Obaida, Mohammed, Saif, Ayub. Question 22. Time to flex those pharmacology neurons. Which test best reveals anisocoria's cause? 1. Pilocarpine 2.5%. 2. Pilocarpine 1%. 3. Pilocarpine 0.1%. 4. Cocaine 10%. Eyes in the dark, choose wisely, everyone. Anisocoria greater in dark suggests sympathetic pathway issue. Think Horner's syndrome. Correct answer, cocaine 10%. Nicely done. 14 of 50 players got it. Kudos Saif, Hassan, Ayub, Sarah. Question 23. Eyelid anatomy fans, this one's for you. Which abnormality defines uroblepharon? 1. Vertical widening of palpebral fissure. 2. Upper eyelid medial ectropion. 3. Upper eyelid lateral ectropion. 4. Horizontal widening of palpebral fissure. Take a close look, eyelid clues await. Uroblepharon often appears in congenital syndromes like blepharophimosis, quite rare but distinctive. Correct answer, horizontal widening. Well done. 15 of 48 players answered correctly. Shout out Ahmed, Saif, Mizo, Bilal. Question 24. Let's talk pediatric ocular care and cosmetic outcomes. A mother brings her 2-month-old son for evaluation of an asymmetric eye. One eye is much smaller with an opaque cornea. Vision prognosis is poor, but she requests best cosmetic result. What is the next best step? 1. Place a conformer to expand the socket. 2. Fit with painted hard contact lens. 3. Fit with colored soft contact lens. 4. Enucleate place scleral conformer. Think carefully. Cosmetic goals often guide early management decisions. Conformers help shape eye sockets early, important for facial symmetry development. Correct answer, place conformer. Great choice. 24 of 44 players answered correctly. Shout out Mr. Native, Ayub, Ahmed, Asma. Final question, let's test your sensory fusion knowledge. During a red glass test in an adult with exotropia, the patient reports seeing a single pinkish light. What does this indicate? 1. Unharmonious arc. 2. Suppression. 3. Pseudo-harmonious arc. 4. Harmonious arc. Think carefully, color fusion can reveal fascinating adaptations in binocular vision. Red glass tests help detect fusion issues in strabismus patients, very useful diagnostically. Correct answer, harmonious arc. Well done. 11 of 45 players answered correctly. Congrats Heba, Manam, Ayub, Asma. Ayub L takes the crown with 23 correct. Congratulations, trivia champion. Mahmood, Safe, Mr. Native, Heba, amazing effort from all top scorers. Thanks to all 65 players, what a fantastic trivia journey together. Until next time, keep learning and smiling.